are working. Of the 44 countries that are endemic, that require interventions, 41 are currently implementing the WHO SAFE strategy. And SAFE is for surgery, antibiotics, facial cleanliness, and environmental improvement. Over 662 million doses of antibiotics have been distributed since 2011 in order to clear infection and reduce transmission. 1.46 million surgeries to treat the advanced blinding stage of the disease have been performed in less than 10 years. And we've seen increased investment in access to clean water and also the promotion of behavior change campaigns in order to reduce people's risk. All of this work so far has led to 10 countries being validated as having eliminated trachoma as a public health problem, with Myanmar being the most recent to have this honor and being validated in September of this year. All of these accomplishments were only achieved because of strong partnership across many sectors. It's not just one group, it's not just one country, it is everyone working together. And Sudan is a perfect example of this. And I believe that with increased investment, they can reach their trachoma elimination goal in the next 5 years. So that map we show, we want Sudan to be one of those countries that's green, that has validated its success. So now we're going to move to our panel to learn more. I will start with Dr. Amir, who will provide us information about his program and what they're doing to create partnerships.
Thank you very much, Angelia. As Angelia already mentioned, I am Amir Kello. I'm medical officer for trachoma with WHO Afro SPEN. SPEN is the Expand Special Project for Elimination of NTDs, and it is established in 2016 as a public-private partnership between member states in WHO Afro, as well as stakeholders for trachoma. So its mission is to accelerate elimination of the most prevalent 5 preventive chemotherapy NTDs and protect more than 600 million people in Africa. The 5 targeted preventive chemotherapy NTDs include lymphatic filariasis, onchocerciasis, schistosomiasis, and cell-transmitted helminths and trachoma. Angelia just mentioned the global situation about trachoma. Trachoma is one of the diseases that are being supported and targeted by SPEN. So the SPEN priority objectives include scaling up to reach 100% geographic coverage. That means including mapping, as well as in scaling up the mass drug administration in endemic areas for the 5 PCNTDs, scaling down in areas where elimination threshold has been reached, as well as supporting countries in preparation of their elimination dossiers, including validation of elimination of countries for specific PCNTD. It also includes strengthening information system as well as supply chain management to ensure better use of donated medicine. We do have a SPEN portal, which is a platform, electronic platform, where information is shared at subnational level about PCNTDs or NTD diseases, including the maps as well as data, treatment data, coverage data. We have as well SPEN Collect, which is a tool, a platform to support baseline mapping as well as impact surveys, surveillance surveys of PCNTDs. The other major priority is partnership that we are basically discussing today, and which is a theme of this panel discussion, which is very important in order to achieve elimination of NTDs in most affected countries. As you have seen in the middle We have a SPEN partnership that includes the member states, the NGOs, pharma industry, research bodies, core NTD, major donors, USAID, Qatar Fund for Development, CBM, the Cost Center, Site Savers, and many, many more, Pfizer, and many, many more. So just to give you an idea of what SPEN is doing, in 2019, 23 countries were supported for MDA in 787 intervention units with a target population of nearly 63 million people. And through the work of SPEN in support of supply chain missions, SPEN managed to save more than 236 million doses of tablets, which is equivalent to more than $18.5 million US. SPEN also provides technical support to member states through its staff members as well as consultants. Coming to the topic of our today's support, SPEN provides support for Trachoma in Sudan, especially in Darfur area, and SPEN provides support only when there is a gap. If there are partners to support activities, SPEN would not jump in, but if there are gaps, that is where SPEN would come in. The Trachoma program in Sudan with support of SPEN is done in collaboration with the WHO country office in Sudan in partnership with the Ministry of Health of Sudan. So SPEN works through governments and Ministry of Health. And as I already mentioned, we support in Darfur area trachoma control activities, baseline mapping, impact surveys, surveillance surveys, as well as MDE. Over to you, Angelia.
Very much, Amir. And I think that really sets the stage when we think about partnership, because it is not just an NGO, it's not a donor. It is also the pharmaceuticals, it's also the governments, all coming together, the research community, really bringing together a lot of different partners in order to address a health issue. Because I think we've all known that health is not just one thing. It's very complex, and which really leads in nicely to our next panelist, Dr. Amani, who was able to join us, because she is talking about how do you strengthen the health system. And so Dr. Amani. Just please bear with us as we work through technical issues. It's the nature of the work. Hello, Dr. Amani. We can see you.
See me. Okay, can you hear me now?
Yes, perfect.
Okay, thank you. Hello, everyone. I am Dr. Amani Mustafa, the Public Health Training Initiative Program Manager at the Carter Center, Sudan. You want me to present my slide, Angela?
Yes. You're pulling it up right now. We're showing it. You don't need to share your screen. There we go. It should be showing.
Not yet. Yes. Okay. I'll talk about the SPHTI. Just briefly, this initiative, it's aimed to build the capacity of the training program for the allied health professionals in order to strengthen their capacity for improving the quality of the health services. And these cadres, mostly they provide services at the level of the primary health care level and in the rural and remote areas in Sudan. So by improving their capacity, it's expected that to improve the health outcomes of the health care service delivery. The objective of this partnership between the Trachoma program and the SPHTI is to align and strengthen the efforts towards the trachoma elimination target in Sudan by 2025. Why we are talking about this partnership now? We all know that the safety strategies in Sudan, it's well progressing and moving towards achieving the elimination target by 2025, inshallah. The only challenge is the TT surgery backlog. This is remained a challenge in Sudan, although there was many efforts to do case finding in some areas. Still, the exact number of the TT surgeries were found were much less than the report baseline before. So the number of the backlog cases still need to be further confirmed, and to accelerate the efforts to avail the services at the remote areas and in those target areas for TT backlog in order to perform them timely to accelerate achieving the target timely. There was a previous experience of training the medical assistant by the Trachoma program to implement the TT surgery, but I think the outcomes were not satisfactory. So this partnership, it came because there is a need for a well-trained health professionals on TT surgeries, and in order to expand and accelerate the TT surgery interventions in the target area and within the target population to be able to reach the backlog timely to reach the elimination target. I'll just talk about how we started this partnership. This is the two programs actually sat together, and we identified the areas that needs the support of this PHTI, and where we can, I think, where we can provide support to the Trachoma program, or together to expand the service for the TT surgeries. This was addressed in two dimensions because the PHTI is addressing the training programs for the pre-service. This is producing new service providers, allied health professionals, and the in-service training programs who are training those health cadres who are already on job. So in addition to that, for these two dimensions, adding the Trachoma health education component to the curriculum of the community health worker and the environmental health, public health officers, which are these two cadres are targeted by the SPHTI program. One of the institutions that is supported by this initiative is the Academy of Health Sciences, which is responsible for the pre-service training of the ophthalmic medical assistant and the ophthalmic theater attendant, who are the main two cadres who perform the TT, can perform the TT surgeries, especially at the primary and the community level. So these two cadres, if they received a well-organized training program for TT surgeries with sufficient practical training, it is expected that they can perform these TT surgeries in those areas that there is more backlog. The other dimension is the in-service training. This again could be addressed through the Continuous Professional Development Center, that is provide training to the all on-job health cadres, and it's there in all, it has branches in all states. This is also for the Academy of Health Science in all 18 states there is branches. So in coordination with the ophthalmic consultants on those target states, through the human resource department, they can guide and distribute the availability of the two cadres, the ophthalmic consultants in the target states, to ensure proper training and supervision for the TT surgeries. The other, in addition to the TT surgeries, is again addressing the prevention part for trachoma in general, and it's suggested to revise and include the trachoma officers in their education package, to include the specific training component in the pre-service training course for the also for the internship doctors who are again the first line at rural hospitals who can see the patients. In addition to that, it's discussed that the Academy of Health Sciences students also can participate and support the TTK's finding in the target states as well. The steps so far, we agreed to move in phases, prioritizing the states with the highest number of backlog in the first stage to accelerate the progress and outcomes towards the elimination target by 2025. Then by putting a joint plan together, identifying all the needs, identifying the supplies, and putting the financial resources together, the plan should be implemented. I mean, we just decided with the planning and preparing for the training packages and the mechanisms. Now we should move forward for the implementation of the training itself at the level of the for the in-service providers as well as at the Academy of Health Sciences. So this is the advancement so far regarding the partnership between the Trachoma and the SPHTI in Sudan. I will stop here for any questions.
Great. Thank you, Dr. Amani.
Yeah.
And I'm very happy you were able to join us. I'm just going to confirm and see if Dr. Belgisa has been able to join.
Okay, I hope. But like. Let me go. She's not joined yet. I'll try to call her because she was thinking that this thing is at 7 o'clock. Here it's still 6. It's not 7 yet in Sudan.
Oh, I see the time difference.
Because when I was talking to her, she told me at 7:30, but like 1 hour difference.
Yeah. Okay. So just because of time, we have less than 30 minutes left.
Do you want me to yeah.
I think what I can do is give a little bit of a background on the Sudan Trachoma program. So for those in our virtual audience, in my role as Associate Director, I support both the Sudan Trachoma Control Program and also the South Sudan program. And so based off my experience working with the program there, I can just kind of provide some context about what we're looking at with trachoma. So if you could show the third slide. All right. So this gives you a little bit of insight into the program. On the left is baseline information. So the way that the trachoma program works and all of the neglected tropical disease is very much rooted in data collection. And this was something Dr. Amir discussed about the importance of data collection and then sharing that information. So on the top, you can see that this map shows that trachoma, anything in yellow, orange, or red, was originally throughout the country. There was almost no state that did not have trachoma in one of the districts within the country. But after years of intervention, each survey came back and showed that trachoma was reducing. And this is in children 1 to 9 years, which is the age group that the program uses to measure success. And currently, as of 2020, you can see that a lot of areas are green. Most of the country is green. So we're really making a lot of progress. The few areas that remain are in Darfur, which because of insecurity in the past was only able to be accessed within the last 5 years. So that region is still catching up. And you can see that there's even some white areas on the map that still need surveys to be conducted in order to get an understanding of the disease prevalence there. So outside of Darfur, you have only a few areas in the non-Darfur regions that have trachoma. And even those, some of the reasons that there's still trachoma is because of insecurity in Blue Nile that prevented access to the area. Now with recent conflict resolution initiatives, it seems like we'll be able to get into those areas, understand what the trachoma prevalence still is, and then provide services. We also have refugee camps of South Sudanese refugees that are on the border that the Ministry of Health, in partnership with the Carter Center, conducted surveys within the camps in order to get an understanding of the prevalence there. And then we have one district in Gadaref that actually had interventions earlier this year and will be doing a survey, and we hope that that will also turn green. So it's just very exciting because every year the map just keeps getting more and more green, more filled in with information. As part of the routine interventions of providing drug distributions and also surgeries, in partnership with WISH and the Qatar Foundation, the national program conducted a study in Darfur, and these are two pictures from that study. So taking blood samples from over 8,000 people in order to see what the trachoma levels were there, in addition to a number of other diseases. Those samples are now with the U.S. Center for Disease Control for analysis. Again, like many projects, COVID has delayed things, but we're hoping to get some very positive information in the next month. So Sudan is really moving forward. MDAs are continuing to be stopped because communities have been reached. One of the main gaps that Dr. Belgisa will talk about, and then also even Dr. Amani was mentioning, is TT. So the surgery that's needed for people to prevent blindness. There are a lot of people who need this surgery spread throughout the country. And for those that don't know the geography of Sudan, many people live in areas that are not accessible by roads. It's deserted areas, it's areas that the rainy season, it completely floods, makes it hard for the health workers to be able to reach these communities. And the idea being, how can we partner with other health groups in order to reach these communities on an ongoing basis? So that's an overview. If Belgisa is able to join, I'm sure she can explain it much better. But I want to use this to then start a discussion among our panelists, and also to answer questions that you in the audience may have had. So as we talk, please enter your questions that you would like to be answered. If you're wanting a particular person to answer that question, also put their name. So with that, I will start with Dr. Amir. And I know that, so one of the things, and I should have mentioned this in my opening, that we are celebrating within the neglected tropical disease community is that the World Health Organization now has a new roadmap for the next 10 years. We have a lot of very ambitious targets about what we want to achieve with eradication, elimination, and control of diseases in the next 10 years. With that in mind, what do you think, how do you think ESPN's work supports health systems strengthening at the government level? Actually, sorry, that was another question. In connection to the roadmap, what do you think are the immediate needs to help countries reach these 2030 goals?
Thank you very much, Angelia. As you rightly said, the NTD community is actually celebrating the huge achievement of finally having a roadmap to 2030 to eliminate or eradicate NTDs. So one of the major areas that need to be paid attention to is due to COVID-19 situation, there is a need to mitigate the impact, the negative impact COVID-19 lockdown and transmission situation in different NTD endemic countries had. So I believe the most important thing is supporting countries, first of all, to develop the NTD master plans in line with the NTD roadmap, but also ensure that they are able to implement NTD activities while assuring also mitigation efforts are put in place to reduce transmission of COVID-19. So that is going to be a huge challenge, and countries would definitely need to have a lot of capacity building, but also financial support, because conducting NTD activities is going to be more expensive than previously thought. As you know, we definitely need to have data, starting with baseline data, as you have mentioned, for example, for Sudan. There are, in Darfur area, due to the humanitarian crisis, there were 11 localities that have not yet been mapped until recently. So there is a plan to map them next year. So while conducting this kind of baseline mapping or impact assessment, we need to ensure that COVID-19 is not transmitted in the community. So personal protective equipment, PPEs, and then newer approach of conducting surveys, MDAs. We cannot have a gathering of communities, huge gathering of communities as we used to when we distributed drugs. Nowadays, we need to think about doing it from door to door to minimize gathering of people and avoid increasing COVID-19 transmission. So the NTD community has to work in collaboration with other sectors, and that is also where the importance of partnerships comes in. NTD community cannot do the job alone. We have to work with others in partnership to tackle the huge challenge that's being faced with endemic communities. Yeah.
Yes. Oh, I agree. And I appreciate you highlighting that we already had a lot of challenges before us, and now we have COVID. And it's important to keep in mind that that will impact costs of programs, not just for Trachoma or other NTDs, but all programs, including Dr. Amani. When you're thinking about doing training programs, you need to think about bigger spaces or less people per training program. And then how does that impact on cost? And I think we're all in the process of really starting to understand what this could mean. Okay. I think, let's see if Dr. Amani is, okay. Can you hear us, Dr. Amani?
Am I back?
Yes, you're back.
Yes, now. Sorry, I'm sorry, I disconnected.
That's okay.
I don't, it's the network issues.
I think it's good because we have people that are joining this conference who may not understand that the challenges we're experiencing now are things that we have been experiencing all the time doing this work. So this is unfortunately normal for us. It's just now more people can see it.
Which is good.
Yeah.
To know the reality. Yes.
So Dr. Amani, we had a question that came from the audience, and it says, the past couple of years have seen a lot of political upheaval and security challenges in Sudan. How has this impacted the Trachoma effort there, or even also maybe your work with the Public Health Training Initiative?
Mm-hmm. Yes, actually, all the security compromise or conflict areas are usually is a challenge for all health services, not only the Trachoma program, and even let's say about all essential healthcare services are not available, or very usually very weak in those areas. But maybe fortunately now with the all the changes happening in the country and the recent peace agreement with all parties, or let's say most of them, those areas are going to be back on the map, and I think they will need more efforts, good planning, more joint efforts, because it's something I think is going to be established from the start to provide all health services. I'm sure that they will need even to assess all the health situation there and prevalence of different diseases or conditions, and they should have a proper joint planning and sufficient resources to address these areas, because these communities now are in most in need, and this is actually the issue of access, the issue of universal health coverage we are talking about to reach the SDGs. So I think now maybe the roads are going to open soon, and we just need to plan together and to align all efforts together to provide these services as packages for all this population who suffered for a long time.
Thank you. And I appreciate that point, because we know that in Sudan at different times, some regions can be accessed and other times it is difficult to reach. And I think it's important for programs and donors to understand that when you see a window of opportunity, you have to take it, because you don't know when that window will close. And so, for example, in Blue Nile, we see a window of opportunity. And so we want to go in, and I know this is true for onco and trachoma and malaria, lots of different diseases, and provide services to communities that haven't had access. And we don't know how long that window will be open. Hopefully, it stays open, but we have to be ready to respond and take that initiative.
Exactly. Taking every available opportunity. I agree.
All right, so for Dr. Amani, I have a question for you. Why is it important to invest in health system strengthening and workforce development?
Okay. Because the SPHI is mainly focusing on investing on health workforce development. So we all know that the health workforce are the cornerstone for any resilient health system. There are shortages, and this is what is happening actually in Sudan for a long time. This is increasing the inequities and reducing the access to health services in different areas. This is again causing more preventable illness, disability, and disease that could be prevented, but unfortunately still going beyond the expected numbers due to these shortages of health services availability in those areas. So universal health coverage and achieving the elimination and eradication targets and the global health security are only possible with adequate investment in the health workforce. So it's something like it's very important to invest in health worker as one of part of the broader objective for strengthening any health system for social protection and.
And that's what I really appreciate about Sudan's future plans, is that the WHO roadmap is very much about health system strengthening. And so the directors of different programs in Sudan are thinking about how can we use the health sector, the workforce, and provide them enough information that they can work on trachoma programs and provide trachoma services, so that we don't have to have separate people just doing trachoma. And I know that they're currently working to put together a proposal about how can we train routine eye care workers who are spread throughout the country, even those really difficult areas to reach, in order to be able to provide services that will literally save people from going blind. And I think this partnership will be very interesting to the global community as other countries start to think about how can they really build up health systems and also integrate into training programs at the country level. All right, another question that we had for Dr. Amir.
Okay.
How, you know, one of the questions we have from the audience is about collecting data and knowing the scope of the problem within a country. And so being confident that you know the scale of the problem. Can you talk about how ESPN collects this data and shares this data so that it can be used by stakeholders?
Thank you very much, Angelia. You know, data is basically provided by the Minister of Health and approved by Minister of Health, and that is what is shared on a SPEM portal. So this is subnational level data about PCNTDs, preventive chemotherapy NTDs, that is available for all stakeholders in national program managers, NGO people, donors. So this is really important because it helps you to plan, but also identify gaps where there are partners, where there are not, including geographic coverage of mapping, but also geographic coverage for MDA. So, and partner distribution as well. So it really helps us with our partners identify where are the gaps, and helps us also avoid duplication. Because as you know, most of the developing countries are faced with restricted funding and lack of resources. And in order to make better use of meager resources, you really need to know where is the gap, but also avoid duplication of activities. So a SPEM portal is like a platform where partners, program managers, donors, NGOs and researchers could access subnational level data of different member states that is online and accessible for everybody. But this is data that is basically shared by the Minister of Health, which is collected through different partners by using standardized methodologies. When it comes to trachoma, it is data from Global Trachoma Mapping Project initially, and now from tropical data. So this is high quality standardized data collection platform that is supported by multilateral organizations, NGOs, as well as member states. And Minister of Health own the data, and they are willing to share the data on the platform. So that is what's made available and helps us make better informed decisions.
Great. Thank you very much. And I appreciate you saying that. And this is we know the problem. We know the solutions. We have demonstrated success. The Sudan program has demonstrated success. We have already 10 countries that have proven it can be done. So this is something that's achievable. And the more we can bring people together to achieve this goal, the better. And actually, I was thinking, Amir, maybe you can put the link to the ESPN portal in the chat box. Yeah, and that way people can access. Sure. So unfortunately, we're out of time. And I really want to thank both of you for participating in this important topic. I know it was a little challenging at first, but you know, this is the way the programs work. I do want to let those who are listening know that the Carter Center has a virtual booth that is open in the Innovation Hub. We have more information about our programs there, including videos about trachoma, river blindness, and mental health. So with that, I want to thank you everyone for participating, and hope you have a good day.
Thank you. Have a great day.
Not sure if we'll be cut.